President Biden late last week laying out his plan for a call on Congress to pass more funding for new COVID vaccine as cases across the nation are on the rise again. We are back now with the panel, and Dr. Marty Makary from Johns Hopkins, our viewers will be very familiar with him, wrote a piece in the Wall Street Journal this week. He says, is this our new drug approval process? There are no human outcomes data on our new shot, which the Food and Drug Administration is expected to approve in the next 2 weeks. Undermining the normal scientific and regulatory process erodes public trust. Horace, he notes that 20% of Americans, that's all we got taking the last booster last time around. The government spent $5 billion on it, and millions of doses had to be thrown away. I'm not sure people know that it's not being tested on humans.
Well, you know, it's interesting about that data because it's concentrated. I went to my doctor in Virginia. I spend most of my time in Texas, and my doctor told me that almost all of his patients are taking it. When I go back to Texas, I can't find a person that is taking it. So this construct where in Washington, everybody thinks this is what you're supposed to do and it's normal. There are Americans all across the country, and they wonder, why aren't we following the normal protocols? Why aren't we doing the kinds of things that give us the kind of assurance? And that may explain why so few people outside of the East Coast and the West Coast are ending up taking it.
Well, and Dr. Fauci's out there talking about this, also the chatter about the new cases and about the new shot and about whether mask mandates are going to come back. Here's what he said yesterday.
I think people need to realize it is extremely unlikely that you're going to see a mandate, for example, from the CDC, which has no authority to mandate anything with regard to masks. They can only recommend it.
Howie, a lot of skeptics, though, because they'll say, sure, CDC only recommends things, but that for millions and millions of people meant mandates on shots, on masks, all kinds of things over the last couple of years. They have fallen out of love, many of them, with the CDC.
That's putting it mildly. I can't believe we're still talking about COVID. I know at least a half dozen people in the last 2 weeks who've gotten it. Unfortunately, it's a milder version. But as far as masks or lockdowns or mandates, the consensus has so radically moved. Looking back now, when we know a lot more, I think there's a feeling that these were failures by and large, not necessarily in every single case. So I don't think we're going to see any rational politician say, we're going to order this. You have to take the shot. You have to get a mask, or you can't go to school, go to work, whatever it is. That would be, I think, at this point, political suicide.
Yeah, we are seeing some individual private organizations that are popping up with some of those things as we track and see. I want to make sure we get to this other topic, though. This week, the Senate is back in session. We saw Senate Minority Leader Mitch McConnell had another public episode that's raising concerns about his health. His doctor has said he's fine. He's cleared him. But let me just give you Nikki Haley's take on this. And she's talking not just about him, but about other lawmakers here in D.C.
It's sad. No one should feel good about seeing that. You know, any more than we should feel good about seeing Dianne Feinstein, any more than we should feel good about a lot of what's happening or seeing Joe Biden's decline. What I will say is right now the Senate is the most privileged nursing home in the country.
So, Marie, now this is a conversation that both parties have to have because they both have very prominent senior members who have questions about their ability to do their jobs.
Well, first on health, I just want to say I had COVID for 18 days earlier this month. It was not mild. It was not fun. And we should get these updated vaccines if you are able to health-wise, because we've gone through this every time we've talked about new boosters with Omicron, who they're tested on, who they're not. Yeah. The reason we are in the middle of a surge and more people aren't in the hospital is because of vaccines. So I just want to say that, having lived through COVID fairly recently. Look, on the issue of health in Congress, I don't think we're ever going to get term limits. I don't think that will ever actually pass. We will never get a constitutional amendment. What I don't know is where the people are in these politicians' lives, their families, their spouses, other members of leadership, other members of their party, because it's quite frankly sad to see what people like Mitch McConnell, Dianne Feinstein, Thad Cochran, I mean, you know, we've worked with a lot of these folks over the years. There is something to be said for having people in Congress with institutional knowledge who have learned the issues, who've been there for years and know, for example, how to get bills passed, how to work with the other side. But it is sad when you see some of these politicians who don't look like they're operating at full strength. And the last thing I will say is we need more transparency. We need more, you know, Joe Biden's physician puts out full reports of his physicals. We need more transparency from, I think, Mitch McConnell's doctor and from doctors who who treat some of these politicians who
Dianne
look like
Feinstein?
they're not Dianne Feinsteins. Absolutely. I would agree with that as well.
Okay, so Wall Street Journal says this: Senate leaders are chosen by their party colleagues who are in the best position to judge Mr. McConnell's continuing abilities. If they think Mr. McConnell can still be an effective leader of an increasingly fractious GOP Senate conference, then, Mark, they say he should stay in the job.
I totally agree. I think the reality is that there is a mechanism there. Senate Republicans can choose their own leader, and they can choose a different leader anytime they want. I don't think that Mitch McConnell's situation is comparable, frankly, to the severe dementia that Dianne Feinstein is struggling with right now. And, you know, as far as mandatory retirement age or some sort of federal rule, I look forward to Nikki Haley calling for Chuck Grassley to retire sometime soon.
89 is still going very strong.
Politicians don't like to give up power.
No, they don't. But meanwhile, there are people saying President Biden should be part of this conversation too. Wall Street Journal, or excuse me, Washington Post, an opinion piece is calling on all of these lawmakers, as Marie has, to be transparent about where they're at. But they note this: the White House press secretary recently said of the president during an appearance on CNN, "quote, it's hard for us to keep up with this president," which is a line she uses a lot. They go on to say it's extremely difficult to believe that Jean-Pierre, who appears to be in good health and in her 40s, is having a hard time keeping up with the 80-year-old Biden. If she really means what she's saying, maybe she should see a doctor too, Horace.
Well, this whole conversation makes me think that in Washington, D.C., what we need is a crypt keeper instead of someone who is checking to see who's healthy and who's not. We're looking at the oldest Senate that we have seen in 100+ years, maybe ever. And we have now the President of the United States, who's the oldest president ever. I'm not saying that we need a rule. I'm not saying that we need a constitutional amendment. But I am saying that in a nation this large, with this many types of people with skills, can't we get people in office who bring some energy and some youth and some vibrancy?
And there's some out there making that as the best argument for them to take some of those places. We also lost a couple of legends this weekend. It seemed to many of us sort of surprisingly soon. Jimmy Buffett and also Governor Bill Richardson. Entertainment, politics. Marie, Governor Richardson, I think, was a shock for a lot of people. And it was his time after governor that really won him so many accolades as well.
That's what's so amazing. Negotiating with these hostile, terrible regimes to get American citizens home safe and sound, whether it was North Korea, whether it was Russia with Brittany Griner. I mean, after he was in office, played such a key role doing the really hard work of diplomacy that often the U.S. government can't do officially. I mean, what a tragedy. I was very sad when I saw that yesterday.
Yeah, and how I think we were most of us shocked as well to hear that Jimmy Buffett was as sick as he was.
Yeah, and I'm very disappointed that we have no margaritas for this part of the discussion.
I know, that is a fail on my part. We should have had the margaritas.
But I mean, everybody knows some of those songs. Everybody knows his voice. But what surprised me in reading some of the obituaries is he became fabulously wealthy as he kind of packaged this franchise about, you know, the beach lifestyle, Key West, taking it easy. And he got to the point where he worried that he was no longer Jimmy Buffett, the guy who, you know, was sitting there with the Mai Tai and the hat under the sun. And so he had to, he tried to stay in touch with his roots at the end.
Yeah. Well, he has given all of us sort of anthems for summer and beyond. And during the break, we'll work on those margaritas. Panel, thank you very much. We'll see you next Sunday.